Admissions are now open for our January and February intakes. Step into your future today. Find us at Blessed House, 5th floor, opposite Garden City Mall. Jesse K. Hospital College of Health Sciences, empowering excellent healthcare.
At JCK Hospital, we understand that a child's smile is priceless. That's why our dental services are tailored with care and compassion to ensure your little ones have the best experience possible. From gentle checkups to specialized treatments, our pediatric dental experts create a safe and friendly environment, making every visit fun and stress-free. Because we believe healthy habits start young. And for the grown-ups, we've got you covered too, with top-notch dental care for the whole family. Visit JCK Hospital today, located in Roysambu, opposite Park University on Lumumba Drive, and experience dental care that's gentle, professional, and family-friendly. JCK Hospital, you first.
A very good morning to you, our viewer. This is healthyyou program by Faith Today TV. We are so much glad that you've gotten to join. And thank you so very much. This is another moment for you to stay informed and to lead healthy lives. Last week, we were able to take care of the health of the mind. And today is yet another time we are coming back to the health of the body. Thank you so much for those that have been viewing. Remember, this program is sponsored by JCK Hospital, located at Roysambu, and the very many other branches available. Please remember to go and get to see them. And today, we are just approaching the World Kidney Day. That's going to be on the 12th of March, this Thursday. And in that spirit, we thought it good. How comes you have your kidneys, you do not know how they function and what capacity they have in terms of your health. And to help us decode matters kidney health and understanding all things to do with dialysis and the hope of navigating chronic kidney disease are none other than two of my guests, and I'm so much privileged to have them today. And one of them is Dr. Hussein Bagha, who is a consultant physician and nephrologist at Mpsha Hospital, and the other one is Ronald Kasyoka. Karibu sana, good to have you on the show.
Thank you so much.
So I would like to take this opportunity and introduce Dr. Bagha. Then you'll take a moment and say hi to our viewers.
Sure.
And then we'll roll the show.
Thank you.
Good to have you. Thank you. So Dr. Bagha, Hussein Bagha is a consultant physician and nephrologist working at the Mpsha Hospital. He's the head of the renal and transplant unit and also the head of the Department of Internal Medicine. Dr. Bagha did his Masters of Internal Medicine training at the Aga Khan University and his nephrology training at the University of Witwatersrand in South Africa. He is also completed his MRCP nephrology. Dr. Bagha is a member of the Royal College of Physicians, the UK, member of the Royal College of Physicians and Surgeons, Glasgow, then a fellow of the International Society of Nephrology, fellow of the East, Central and South African College, and the fellow of the Royal College of Physicians. So good to have you, Dr.
Thank you.
Welcome aboard.
Thank you so much.
And Ronald Kasyoka is a kidney health advocate, and we are good to have you. So just simply say hi to the viewers, make them welcome.
Hello, everyone, and I would like to welcome you to the show. As he mentioned, that kidney health is very important, and we are celebrating the World Kidney Day this week on the 12th of March, which is going to be on a Thursday. So I'd like to welcome all of you. Thank you.
Thank you so much. Ronald.
Thank you so much for having us. My name is Ronald Kasyoka. I'm a keynote advocate and also an author of a book where I share now my personal journey, living with kidney disease for the last 7 years.
Wow.
To inspire and encourage other patients and also people going through difficult challenges. The month of March is the World Kidney Awareness Month, and on date 12 will be the World Kidney Day.
Thank you so much. Good to have you. So today, our viewer, it's a special day. We have two guests. One is who is an expert, is going to help us debunk this particular subject. And the second one is an advocate who is going to be helping us navigate from a real story how the journey has been. So, Dr. let us just begin this rolling this ball from the basics. So what do we understand? What is the importance of this kidney? When God positioned the kidney in the body of a man, what was he looking at? And then what does chronic kidney disease look like?
So those are very important questions. First, it is important to understand where the kidneys are located.
Yes.
A lot of patients come and tell me that they have kidney pain and point here. Your kidney is actually located at the back, where I'm pointing. And God has given us two kidneys. And they perform very important functions in the body. One of the very important functions is removing the excess water. Remember, we consume a lot of water as well. Now, all of that excess water, which is not utilized, has to be removed. So some of it is removed through sweating, but majority of it is removed through urine. And this passes through the kidneys as the kidneys filter it out. A lot of toxins are produced in the body. The body is continuously working and functioning. So it produces a lot of toxins, a lot of poisons. All of these are basically removed by the kidney. Then we have important electrolytes or minerals that are found within the body as well, like potassium, sodium, calcium, and magnesium. All of those have to be regulated and kept within a certain range. Otherwise, the body will start malfunctioning or not functioning well. So the kidney is very important in that aspect as well in terms of regulating these electrolytes. Because if you get very high, let's say, for example, very high potassium or low potassium, it actually affects your heart as well. Then another important function of the kidney is also maintaining your blood levels to a certain range. So it actually helps the body to produce more red blood cells by producing a certain hormone called erythropoietin. It is also important in producing vitamin D as well, important in making sure that your acid-base balance within the body is maintained. So all of those are very important functions of the kidney. And once the kidney starts failing, then you develop kidney disease. And if it's prolonged for more than 3 months, then you are classified or categorized as having chronic kidney disease. So there has to be a time frame to it of 3 months. So after 3 months, if there's been no response and no improvement to treatment, then you're classified as having chronic kidney disease. And the only way, and I can't overemphasize this, the only way to know if you have chronic kidney disease is by doing the kidney function tests and a urinalysis. So it's a blood test, which looks at certain parameters, which I'm sure we're going to talk about, and a urine test as well. Without doing those two, you can never know if you have kidney disease or not. Yes.
Great. There's, I think research has talked about kidney disease being a silent disease. Maybe you can decode that and help us get the gist.
Excellent. So another very, very good question. Majority of the patients don't realize they have kidney disease. They are walking around, they're carrying on with their normal lives. Because remember that kidney disease, there are stages of chronic kidney disease from stage 1 to stage 5. Now, in the very early stages, up to stage 4, you may not have any symptoms whatsoever of kidney disease. Okay? You may feel a bit tired, especially in stage 4, but that's it. And how many of us feel tired every day?
Very.
Yes. So we all assume that we are working very hard, and this is why we are tired. But unfortunately, very many people ignore these subtle symptoms. And when it reaches advanced kidney disease, like let's say stage 5, you notice that your legs may start getting swollen. Yeah. But again, people will say, oh, I'm standing too much, so it gets swollen. When I sit down or rest and put my legs up, it reduces. You're like, okay, fine. So nothing much to worry about. So by the time the actual symptoms set in where you can't breathe because there's a lot of fluid in your body, or you start itching because the toxins are being deposited everywhere in your body, you have a lot of nausea and vomiting, then it's already late. You're already in stage 5 chronic kidney disease. So from stage 1 to stage 4, you may not have any symptoms. And yet the disease is still there in the body and is progressing. And this is why it is called the silent killer. A lot of patients are actually missed. They come to the hospital, the symptoms are brushed off, and then they come now to the emergency department with end-stage kidney disease, and there's nothing much you can do apart from offering them dialysis. So this is where our major challenge comes in. And as I mentioned, without doing the tests, you can never know if you have kidney disease or not.
So let us stop moving by assumptions.
Yes,
let us
exactly.
Go with the evidence.
Definitely.
Go do the test, do the renal function test, get to know. Proper diagnosis ensures that there's earlier treatment.
Yes.
Maybe you can just go a little bit higher. Tell us what are the risk factors that lead to this kidney disease, or even when how does it progress to now chronic
Yes.
chronic kidney disease. What are these risk factors people get exposed to? Some of them, which ones do they avoid mostly?
So the most common risk factors for developing chronic kidney disease anywhere in the world, including in Kenya, is diabetes and high blood pressure or hypertension. We have an epidemic of those two. A lot of my patients have hypertension, and a lot of my patients have diabetes. Now, when you have hypertension and diabetes, your risk of developing chronic kidney disease increases significantly, by almost 40 to 50%. Yes. So if you have those two risk factors, then you need to be on very close follow-up with your physician and request him or her to be checking your kidney functions on a regular basis as well. Obesity is another risk factor. Obesity is becoming more and more rampant in our society. Yes. And when you get obesity, the patients actually develop diabetes because it is the commonest risk factor for developing type 2 diabetes, and they also develop hypertension as well, which subsequently leads to kidney disease. But obesity directly also causes kidney disease as well. So again, you can see how dangerous obesity is. Then a family history of chronic kidney disease. So if anybody in your family has chronic kidney disease, there's a high risk of you developing chronic kidney disease as well. Taking over-the-counter medications. How many of us walk to the pharmacy and tell them I have a headache, and you're given Brufen or you're given diclofenac by the pharmacist? Nobody asks you if you have any medical conditions, if you're allergic to these medications. So these non-steroidal anti-inflammatory drugs are very dangerous for the kidney. They actually damage the kidney irreversibly. So you have to be very, very careful when you are just going to the pharmacy and buying over-the-counter painkillers like that. Herbal medicines. In Kenya, we see a lot of that happening. I mean, patients are promised everything. That, oh, if you take this herbal medicine, you're going to be fine, your diabetes will be cured, your high blood pressure will be cured, your kidney disease will be cured. But what people don't realize is that nobody has tested those herbal medicines. We don't know how the herbal medicines are going to react with our body. They have led to kidney failure in a lot of my patients. They've led to liver failure as well. So that's another very common thing that we have seen in Kenya as well. People taking these over-the-counter medications, painkillers especially, and also taking herbal medicines. And those are the very important risk factors that people can avoid. Yes. The other important risk factor is when you have had a kidney injury before. Like, for example, if you're very sick, you're admitted in the hospital either because of some food poisoning or some malaria or some other infection, and you develop acute kidney injury, and then it resolves. Everything goes back to normal. But then you are already at a higher risk of developing kidney disease later on in life. So you have to be cognizant of that fact as well. Then we have HIV, hepatitis B, hepatitis C, and all of those are risk factors as well for developing chronic kidney disease. So if you have any of these risk factors, then you need to have your kidney functions tested on a regular basis. Things to avoid are your over-the-counter painkillers. If you're having persistent headaches, then go and see a doctor and see what could be the cause and see how you can avoid those headaches rather than just popping in pills every day. Avoid going to the herbalists and taking herbal medicines because those are very dangerous as well. Be healthy, eat a healthy diet, drink plenty of water, exercise regularly. This helps to keep your kidneys healthy as well.
Thank you so much, Dr. Bagha. Maybe diabetes and hypertension is a very common condition in our society today. Maybe you can help the audience out there to understand how is diabetes and hypertension affecting the kidney, because most people, I'm told clinically, diabetes is not a problem. The complications of not managing it properly is what leads to these other things. Even the kidneys as well. The complications of not managing these conditions lead or heighten to that particular level. So how does it affect the kidney? Maybe make them understand.
So you see, what happens in diabetes is that your body is not able to utilize the glucose. So it's not only the sugar that you eat that leads to a spike in glucose. All foods are eventually broken down to glucose and then absorbed into the body. So there are some foods that will give you a very high glucose level after eating. We call it a high glycemic index. And there are some foods that don't give you a very high glucose level after eating. Those are foods with low glycemic index. Now, when you have diabetes, your body is not producing adequate insulin, which helps to take that glucose from the blood into the tissues. So the glucose stays longer in the blood. Now, glucose is not an inert entity or molecule. So it starts reacting with certain other molecules and starts getting deposited within the blood vessels. The same blood vessels are the one that are supplying the kidney, the one that are supplying the heart muscles as well. And as time goes on, 5 years, 10 years, 15 years down the line, a lot of changes take place within those blood vessels. The blood vessels become very narrow. There's also the aspect of inflammation that diabetes causes as well. Now, when the blood vessels become narrow with the aspect of inflammation, there's reduced blood supply to those critical organs. And now you find that you're developing kidney failure. Or you also develop heart failure as well. Or you develop a heart attack or you get a stroke. So this is diabetes. So you can see how just sugar itself within the blood, if it's not controlled over a period of time, it actually leads to these critical events. Now, when it comes to high blood pressure, the analogy I always use is if you have a pipe and you're pumping water through it at very high force, which is what high blood pressure definitely is, okay? Yeah. What happens to the inner lining of the pipe over time? It starts getting eroded, isn't it? The same thing is happening to our blood vessels. And especially those blood vessels that are supplying the organs are very small because as they keep on dividing and branching, they become smaller and smaller. Now imagine that same pressure is being transmitted through the blood vessel. So what happens is, over time it starts getting eroded, the inner lining of the blood vessels, and then you start forming clots. And that pressure is also transmitted to those organs like the kidneys and starts damaging the kidneys over time. It doesn't happen overnight. It can take 5 years, it can take 10 years. And the worst thing with high blood pressure is that once the kidneys start getting damaged, they start releasing chemicals in the blood called hormones, which worsen your blood pressure, which worsen the kidneys, which worsen the blood pressure. So it becomes like a vicious cycle. Yeah. So this is how both diabetes and high blood pressure actually damage the kidneys, and it's important to control that.
Thank you so much. Maybe you can conclude this first section by which group of people are more vulnerable to kidney disease? Maybe the people think it's because of age, they're aging, young people.
Kidney disease can affect all ages. So you can be born with a kidney disease because of congenital malformations of your kidneys and urinary tract. You can develop glomerulonephritis, which is an inflammatory condition that damages the kidneys. You can develop kidney disease because of diabetes and high blood pressure. Remember, type 1 diabetes also damages the kidneys as well, and type 1 diabetes affects the young children and the young adults. Then, of course, you can get type 2 diabetes and high blood pressure in your 40s and 50s. After the age of 50, men can get prostate enlargement, which can damage your kidneys as well. So it can affect all ages. Yes. Unfortunately, it doesn't affect the children as much because we don't get a lot of congenital malformations, which is a good sign as well, which is a good thing for the children. But then subsequently, you can get caught at any point in time as you age along.
Thank you so very much. I think I've gotten to learn a lot, debunking, especially that bit of the thinning of the blood vessels because of the sugars and even the hypertension effects on the kidney. So thank you so very much. Allow me to take the ball into the court of Ronald here. Ronald, it's been 7 years.
Yes.
Tell us about that journey.
For the last now 7 years, I had kidney failure in 2019. Back then, before then, I used to have a condition known as nephrotic syndrome from around 2012, and I was on continuous medication. But the condition now later on progressed now to kidney failure. That's in 2019, and that's when now I started my dialysis treatment 2 times a week. My experience on dialysis treatment, I can say that at first it was quite challenging because back then I was actually in high school. So it became a challenge for me to balance between my studies and also my health, because you have to realize that as a dialysis patient, because when you have kidney failure, it means that your kidneys are not functioning well. And now a dialysis comes in to do the work that would have been done now by the health kidneys. So being on dialysis treatment and also just having to go to school, it's quite challenging because you find that for 2 days in each week, you are out of school. So that time was actually the most challenging for me because I was just transitioning to Form 4. So you can imagine I'm in my final year in high school and now with the kidney disease and I'm missing 2 days every week just to go for my dialysis treatment. So I used to miss a lot when it came out to my academics. But good thing I had now the support back in school and also at home. I had the support in school of my friends and also my teachers. So the moment when I came back, I was able now to be guided just to catch up on the things that I had covered the days that I was away from school. And also at home, I had the support that I needed, because one of the things that I've realized is that when battling this condition, the kidney disease, and it's not just about the kidney disease, but the many other chronic illnesses, the support network around you plays a crucial role in you just going on the condition that you are in. Because for me, I've seen what support can do from just the family, the close friends, the people around me, and also even joining the support groups, because I've been very active in the support groups across main dialysis centers and also hospitals. And one of the things that I always get to see when you get to those interactions is that you find that the patients are able to come together and they're able to interact one-on-one. And you find that by just you hearing from someone who is going through the condition that you are going, just that is able to provide the comfort that you need, because they're able to understand you from a point of, yes, I'm going through this, I know what you are going. And I feel that is one of the most things that many people struggle with if you lack now the support network, because you find that when you're going through a challenging time, a lot of questions can come in life. Why me? Why this have to happen at maybe this young age? Especially for me, because I was in high school. I have dreams that I want to achieve in life. There are things that I want to do. So you find that a lot of questions come in life, most of which we do not have answers to. And when you don't have people who are close to you who really better understand you, you may feel more of an outcast or isolated, because when you are not able to explain, just voice out what it is that you are going through, and also the challenges that you are facing now through the condition that you are going through, the people who are around you are not able to know how to better love you and also how to better care you. And that's one of the things that I struggled with, because for the first 2 years, now after I fell sick, that is the moment that I started dialysis treatment, it was the most challenging, because I found myself isolating myself. Actually, I went through one of the most challenging, because through the isolation, I used to think people do not really understand what I was going through. And I used to see myself as an outcast. I remember I just isolate myself in the house. I used to come out of the house only when I was going for my dialysis treatments. These are just the 2 days that I have to go for my dialysis treatment, or maybe I have to go for a clinic. And also, that is after now I finished my high school. Those first 2 years, it was really challenging. And now looking back to that time, because I used to think people would not really understand, I see that I'm the one who was supposed now to speak and share how it is that I felt, and also what it is that I was going through, for them to be able to understand more and also better, and so that they can also be able to extend their love and their care. But now I'm at a point where I can say I've reached at a point where I've accepted the condition, not giving up, but accepted that, yes, I'm going through this condition. And if I'm going to keep moving forward and try and live as normally as possible, I have to accept that and just live with this condition. And through my journey, because my advocacy journey actually began at the point where I was able to accept now the condition that I was going through around 2 years ago, actually, not really long time, because before then, I remember that time I was just in isolation. I did not really have much going on. But the moment that I decided to step out and just to share my story, what it is that I was going through, just as a way of inspiring others, actually what led me now to the kidney advocacy journey is that I realized that most of the patients who are diagnosed with kidney disease, they tend to lose hope in life. and not just the kidney disease alone, but the many other chronic illnesses. You find that most of them tend to lose hope in life. You find that if someone was going to work, they stop going to work. If someone was a student, they may stop going to school. And that's actually what now led me to do something that really spark up in them. I wanted to show them that despite the challenges that you have to go through, they still live after the condition, they still live after the kidney disease, they still live. You can just live and do the things that you want to do. And that's what led me now to write the book. And the book now introduced me to the kidney advocacy space. The book, my first book, was Embracing Hope, where I share now my personal journey battling kidney disease to inspire and encourage other patients and also people going through difficult challenges, to show them that it does not matter what you're going through, that you can still live your life, do your things. You just have to believe in God and keep pushing forward. And through that, I've been able to interact with many patients, caregivers, just as I move across, because I sometimes find myself just moving across the dialysis centers just to interact with the patients, have one-on-one conversation. And I'm always inspired when I just talk to someone, they're able to share their story and also how their treatment has been going. And after now, I mentioned that I'm going also through the same condition. They actually feel comforted to see someone is embracing this journey with the courage and also the resilience that it needs. And that's actually something I'm always happy to see. Yeah.
Well, that's commendable. I think you've really divided the details I wanted to hear this morning. Thank you so much for that journey, and we thank God for the journey. Maybe even as we prepare to go into a short break, so that the people can begin to send in their questions and any queries they have, so that the Daktari here and Ronald can get to respond to it. What one word do you have for caregivers, for support networks, for parents who have, or for even families who have such kind of a patient? What one word do you have for them, so that as they continue this journey of hope, they can keep their hope in that?
It can be challenging sometimes caring for someone going such a challenging moment because all the days are not the same actually. I cannot say even in my life all the days are actually the same. There are days that you wake up, your mood is just off. All you just want to do is just take some rest. And also there are days that you just feel energetic, you just want to do and do more and more. So what I would say to them is that understand what the patient is going through. And for you to understand what the patient is going through, it's for them to be able to share what it is that they feel. So have that close relationship with them so that you can be able to understand them at a close level. Because when you're able to understand them, you will see and be able to notice the days that you're able to notice how you're able to just care and love them on the different days.
Okay.
Yeah.
Thank you so very much. So we are running into a short break, but remember this program is sponsored by JCK Hospital. This is healthyyou program where you stay informed and healthy. Remember, in the first section, being able to cover chronic kidney disease. We've looked at the risk factors. We looked at journeying with kidney disease. So in the second segment, we're going to be looking at dialysis, treatment, management, and what are some of the prevention strategies we have. So otherwise, keep on sending in your questions. We'll be covering all your questions to make sure that you are informed and you're living healthy lives. So remember, this is healthyyou, where you are informed and to live better lifestyles for your family, for your communities, and the entire nation. So see you soon after the break. Thank you.
Every great journey begins with a single step. And at Jesse K. Hospital College of Health Sciences, that step is met with warmth, guidance, and possibility. Here, learning goes beyond the books. It is where future healthcare heroes are nurtured by passionate instructors who believe in their potential. From theory to practice, our healthcare assistant students gain real-world skills in real healthcare settings, preparing them to serve, support, and make a difference from day one. Because at Jesse K. Hospital College of Health Sciences, we don't just teach healthcare, we empower excellence. Admissions are now open for our January and February intakes. Step into your future today. Find us at Blessed House, 5th floor, opposite Garden City Mall. Jesse K. Hospital College of Health Sciences, empowering excellent healthcare.
Welcome again, our viewer. We had such an amazing first segment. We are here yet again for the second segment. We had a deep dive to looking at the risk factors, the warning signs, what are some of the things you need to look at, from diabetes to hypertension, how do they escalate the kidney disease to also the chronic kidney disease. We looked at the advocacy journey of Ronald here, and how do you embrace the journey of hope, not just to get accepting it, but how to know how to live with it even as you undergo treatment. So in this second segment, we want to go straight into the treatment. Then after treatment, we'll now be looking at your questions. So keep on sending on your questions. We have so many questions coming in, a lot of shout outs, people are watching. Thank you so very much, that those that are learning something this morning. So to help us understand the treatment modalities available for kidney patients or people who are undergoing this condition, what should they do, Dr. Bagha?
So it basically depends on what stage of kidney disease you are at. Yeah. So of course, first things first, we have to address the risk factors for developing the kidney disease. As I mentioned earlier, that the most common risk factor is diabetes and hypertension. So you need to make sure that you are on the right medications for the diabetes and the right medications for the hypertension as well. And you need to control your blood pressures, and you always need to control your blood sugars as well. Because remember, if you don't control those risk factors, the kidney disease will progress to advanced chronic kidney disease and subsequently end-stage kidney disease. Okay?
Yeah.
A lot of times patients come and ask me, oh, why is my creatinine going up? Now, creatinine is a blood test that you do to assess your kidney function. And the higher the creatinine, the worse the kidney function is. So they'll always be like, oh, my creatinine is going up, but I'm like, but your blood pressure is persistently high, and so is your blood sugar as well. So you need to control your blood pressures and your blood sugars. Then there are certain medications that we do tend to use, which are now available in Kenya, to try and slow down the progression of chronic kidney disease as well. So there are those medications available, and if you do fit the criteria, then definitely your kidney specialist should start you on those medications. Then remember the functions of the kidneys that we talked about earlier on, making sure that your blood levels are normal. That means your hemoglobin levels, controlling your acid-base balance, controlling your electrolytes as well. Now, when you reach advanced stages of kidney disease, all of those get affected. So part of the treatment now is going to be addressing those functions as well. So you may be given medications to boost your blood levels. You may be given medications to boost your iron levels. You may be given medications to prevent a lot of absorption of potassium from your diet as well, because that is dangerous if your potassium goes up. Now, when you reach end-stage kidney disease, then you require renal replacement therapy. So either you undergo dialysis, or you are given an option of a kidney transplant. Of course, a kidney transplant is a much better option as well. But unfortunately, majority of the patients are first put on dialysis. So there are two types of dialysis. Okay, one is called hemodialysis. The word hemo comes from blood. So this is basically a purification of the blood. So you put in a catheter, which is a pipe. Blood comes out of the body into the machine we call the dialysis machine, or a surrogate kidney. It cleans the blood, removes the toxins, removes the excess water, regulates your electrolytes, regulates your acid base, and then the blood is returned back to the body. Now, for this, you have to go to the hospital. Each session is 4 hours. Of course, there's an aspect of arriving early on, 1 hour before, and then you have to stay in the hospital 1 hour later. So technically around 6 to 7 hours, twice a week of your life are gone in the hospital. And the other type of dialysis is called peritoneal dialysis. The peritoneum is a covering within the abdomen. So you put in a catheter in the abdominal cavity, you put in some fluid inside, again the same changes take place, and then that is removed. But that you have to do it 4 times in a day, minimum, every day. You can even do this at home, and that's the advantage of that. So those are the 2 types of dialysis that is one of the forms of renal replacement therapy apart from a kidney transplant.
Maybe you can talk about what you're doing at MP Shah. Look at what when it comes to transplant, getting transplants. What is happening in the market of Kenya, the patients of Kenya? Do they prefer transplant dialysis? What are the thought process in terms of deciding for the modality?
As I was mentioning, majority of the patients are on hemodialysis. Dialysis, and we mainly offer hemodialysis in Kenya. Unfortunately, because why am I saying unfortunately? Because peritoneal dialysis offers significant advantages over hemodialysis. Remember, for hemodialysis, you have to come to the hospital twice a week. 6 hours of your day are spent in the hospital minimum. So on that day, possibly you can't go to work. You miss work for those 2 days. It becomes quite challenging. Then you have these catheters, and these catheters can get infected. But the Shah reimburses a hospital for 2 sessions of dialysis per week. Each session of dialysis is around 10,500 Kenyan shillings. So by paying a nominal fee, you can get 8 sessions of dialysis in a month, covered fully by Shah. Okay. Now, a kidney transplant costs between 2 to 2.5 million Kenyan shillings. Shah covers only a quarter of that cost. The rest of it, the patient has to contribute, okay, or pay up. And this does not include the pre-transplant workup. And then subsequently, after a kidney transplant, you have to be on medications for the rest of your life. Remember, the new kidney is a foreign tissue. So your body recognizes it as foreign and will start producing antibodies to kill that foreigner, isn't it? It's like an invasion.
Yeah.
So the body will try to fight that new kidney. So you have to give medications to suppress that immunity so that the body does not reject the new kidney. Now, these medications are for life. Every month they cost around $300 to $400. Shah heads say that they're going to reimburse that amount. They do it at Kenyatta National Hospital, but there have been a lot of shortages, not very consistent. So patients have to be prepared with the $300 to $400 every month for infinity. Now, how many of us can afford $300 to $400 just for medication alone? Yeah. So when I talk to my patients, yes, dialysis, transplant has a mortality. It increases your survival. There's so many complications that you avoid with when you're transplanted vis-a-vis dialysis. But when the patients are told about the fact that they have to pay up for the post-transplant medication, because people can do harambes and come up with the money for the kidney transplant itself. But the issues we get is after the transplant. What happens then? Because they are like, if Shah is paying for the dialysis, why should I have to struggle to look for that $300 to $400 every month? So it becomes quite challenging. And we know that transplant is the superior option. And we know that, if you look at it, if I'm paying 30,000 or 40,000 for the medications every month, vis-a-vis paying, if you multiply 10,500 by 8 sessions, that's almost 84,000 shillings. The government is saving 44,000 every month if they were to support the transplant medications, so that the patients can get transplanted and they'll be willing to get transplanted. So the government saves 44,000 for that one patient whom they'll be dialyzing indefinitely, isn't it?
Yeah.
By just paying for the transplant medications.
Yeah.
So that is a huge cost saving for the government as well. And then that patient, same patient who's supposed to be missing 2 days in a week, on dialysis or 3 days in a week on dialysis can go back to work on those 3 days, contribute to the GDP as well of the economy. So those are the indirect cost savings as well. So I've written a whole paper published in an international journal as well about the health economics, about why transplantation is superior to dialysis. Even if the government ought to pay fully for the transplant and the anti-rejection medications, after 3 years you are making huge cost savings, which are now can be channeled towards other chronic diseases, towards cancer, towards treatment of high blood pressure, towards treatment of diabetes as well.
Wow.
Yes.
Profound. You've done a paper.
Yes.
I've heard that. I think you can share it with us so that we can also give it more publicity. And we are preparing for the questions here, and so many people are sharing in their questions. Allow me to give some shout outs. Thank you so much, Lewis, for watching. I can also see Maggie. I can also see Jane. They're responding here that they're live and watching us. Thank you so very much. I hope you're getting value. We have some few questions coming in here. I think we can get to cover them. Then we proceed. Can someone with kidney problems still live a long life, or does dialysis mean body is already failing? This is Jimmy asking.
So a very important question. Now, when I first started practicing nephrology several years ago, when I would mention to anybody that their kidneys are damaged and they require dialysis, they would literally walk out of my clinic. Because it's a myth that once when you're on dialysis, it's a death sentence. And I'm sure that Ronald will attest to it, and you can also ask him for his experience. But when you start dialysis, you can lead a very healthy life as long as you are conscious about the fact that you need to be careful about certain things, certain foods you need to avoid, about your water intake, about exercise, all of that. The longest patient on dialysis, not with us, but from the US, is 53 years. 53 years. So, yes, dialysis has its disadvantages, but it is life-saving. Yes. When you start dialysis, you do get a bit of problem because your body has to your body is acclimatized to all those toxins and poisons and everything. So when you remove them, your body will feel a bit tired, exhausted. But over time, after the 4th, 5th session, you feel much stronger. Your blood levels improve, the toxins are out of the body. At the MP Shah Hospital, we have actually started nighttime dialysis, meaning that anybody who is working and wants to continue working comes in at 5 p.m. or 6 p.m., gets dialyzed, goes home by 10, 11, goes to sleep, wakes up in the morning and goes to work. Yes. And we have several patients doing that currently. So that you don't have to lose your job, or you don't have to sacrifice your job for your kidney disease. Yeah, maybe Ronald, you would like to add something?
Sure, I can say for me, what I've realized is that, as I mentioned, most of the patients tend to lose hope in life. But what I believe is that the moment that you understand the condition, you understand what it is that you are going through, and also you get to accept, yes, I'm going through this condition, and you are open about seeking the help that is needed, that is now from the healthcare professionals, and following on the guidelines that you are given when it comes now to even the dietary restrictions, and also ensuring that you are at your mental health is well taken care of, because actually that's crucial when you're going through kidney disease. I believe you can live a normal life because I can say that living my life to the fullest because as I mentioned, I've written 2 books. Here are my 2 books, and all these books I've written while still on dialysis. By the way, I'm still on dialysis treatment, but currently preparing for a kidney transplant. And for those 7 years that I've been doing dialysis, I've managed to write 2 books, and we also run an initiative, by the way, an organization. It's a foundation, RKF Kidney Health. It's an organization where we are supporting now dialysis patients and their caregivers. We offer psychosocial support and also creating awareness on kidney disease. And through the programs that we run, we have the quarterly lecture series, and the name of the book, Embracing Up lecture series, where now we gather the patients and the caregivers, and now we have the healthcare professionals, a doctor, a nurse, a counseling psychologist, come and educate now on the topic that the patients want to be educated on. And also we give the patient an opportunity to interact among themselves, just share stories. And when the patients are able to interact and share stories, and you meet someone who is, despite the challenge that he's going through, is living a normal life, is trying to just continue on with the thing that he's doing, that actually inspires someone, because when you see someone just having a normal life, continue on despite the treatment, all of that, I can say that's just about the acceptance. If you just accept the condition and you fall on what you've been advised to do by the doctor, and also take care of yourself, everything is always okay.
Wow, thank you so much. You can lead normal lives even though you're on
true.
dialysis. You've written 2 books
Yes,
went through that particular journey. Thank you. Congratulations, and thank you so very
thank
much.
you.
I think Steve is asking about kidney transplant. I think that has been answered. You talked about the conditions and the parameters they need to be taken care of while they are on treating their kidney. Somebody's asking which food is good for the kidneys. Flo.
So, if you don't have kidney disease, eat a healthy diet. And a healthy diet means half of your plate, and I always feel that is very important, should be with vegetables. The other half you divide into starch and proteins. And you eat that on a daily basis. You see, these processed foods are very dangerous because they contain very high contents of phosphates and salts and everything to keep them have a longer shelf life. Yeah. So eat healthy diets, balanced healthy diets. Drink 1.5 to 2 liters of water every day if you don't have any restrictions as well. Well, if you have developed chronic kidney disease, then as Ronald put it, that there are some dietary restrictions. We need you to restrict your foods that are high in potassium, especially bananas and avocados and potatoes, which is a very staple diet for us, unfortunately. Okay. Avoid foods that are rich in phosphates as well. Okay, like dairy and eggs. But again, your doctor should be able to guide you, depending on your stage of kidney disease, what to avoid, what to eat, what quantities to eat as well. We're not saying that stop everything. Moderation. There are ways in which you can leach those potatoes, you can leach those green grams, and you can still have them in smaller quantities. When you leach them, you remove the potassium, remove the phosphate, and then you can safely eat those. Yeah.
Another one is asking, should I be worried about my sugar cravings?
Well, if you get a lot of sugar cravings, then one is that you need to control your sugar cravings, obviously. Yes. But always get yourself checked to see whether if you've been eating a lot of these processed sugars and chocolates and all this, once in a while just pop into the hospital. I mean, you can even pop into MP Shah Hospital today, because this whole week, which you're marking the World Kidney Day on Thursday, but we are doing celebrations the whole week, Monday to Friday, where you get free screening done for kidney disease from 8 a.m. to 2 p.m. every day, and it's free of charge. We'll do your blood sugars, we do a urine test for you, there's a doctor you will see, there are nurses you will see, they'll advise you on what to do, how to make sure your kidneys are healthy, if everything is fine. They'll even refer you appropriately in case if you find that your sugars are very high, or if you find that your urine has a problem as well. And all of this is being done this whole week until 13th at the MP Shah Hospital, the main hospital, at Village Medical Center, which is in Village Market, and at Spring Valley Medical Center. And it's free of charge. So you can just walk in and say that you want to have your screening done for kidney disease. And you'll just see the posters and everything outside the hospital.
Wow, thank you so very much. Martha is appreciating us and is saying she's so happy to hear the doc say that dialysis is not a death sentence. Her aunt just started dialysis last month, and she was wondering if this is something she will do for the rest of her life, but there's hope for her because of this particular session. The last question for the day is, can herbal medicine damage the kidneys?
And the answer is yes. Herbal medicines can damage your kidneys and cause kidney failure. So please avoid all herbal medicines. Yes.
Wonderful. Maybe, yes, do kidney stones affect the body forever?
So it depends on the cause of kidney stones. So what are kidney stones first? So kidney stones are, as the name suggests, these are stones found within the genitourinary tract system. So they can be found within the kidneys. They can be found in the pipes we call ureters that connect the kidneys to the bladder. And they can be found in the urinary bladder as well, where the urine is stored before you expel it out. So most common cause of kidney stones is not drinking enough quantity of water. But then there are some other causes of kidney stones, like very high uric acid levels. So people who love the nyama choma and alcohol, again, majority of the Kenyans, they have high uric acid, and high uric acid can cause kidney stones as well. Uric acid doesn't only cause gout, but can also cause kidney stones as well. So if you have those risk factors for kidney stones, then you can get recurrent kidney stones. So that is there. Some people get only one of stones because they live in those dry areas where they don't take adequate water. Remember, our urine is full of electrolytes as well, electrolytes. So some of these ones actually precipitate, especially if it's concentrated, is passing, and when they concentrate, can precipitate and stones. Yes. So you're taking a lot of water to flush all of those electrolytes, make sure that you don't get the stone.
Wow.
Yeah.
Even as we come to a close, maybe Dr. Ka, what if all of us to what to remember key messages on the health, what would those messages be?
The kidneys are very, very important in the body. As we have mentioned, they have myriads of functions. Yeah. 2, always protect your kidneys. Yeah. If you're at risk of developing kidney disease, if you have diabetes, if you have high blood pressure, if you are obese or overweight, if you have family history of chronic kidney disease, please get your kidney functions checked regularly. Okay? Developing chronic kidney disease is not a death sentence. We do have medications now available, lifestyle choices available, dietary choices available that can help slow down the progression to end-stage kidney disease. Even when you reach end-stage kidney disease, it is not a death sentence. Dialysis is not a death sentence. Transplant is a better option as well, still. And we are hoping that this message goes out even to the SHA people and to our Ministry of Health, that every patient should be given a chance for a kidney transplant, and money should never be a factor.
Wow. How can our viewers get to connect with you, interact with you? How can they access you? Maybe
I have a YouTube channel as well, which I have started from last year, where I post videos regularly in simple terms about kidney health, how to protect your kidneys, what to do when you get kidney disease as well. It's Bagha Hussein at Yahoo. This is the handle is Bagha Hussein. I'm on LinkedIn as well, Instagram as well, TikTok as well. I'm available at the MP Shah Hospital. You can just call the main hospital and get me there as well. You can ask me questions through my social media. I always respond to them, either late at night or early in the morning. Yes. So please feel free to reach out.
Thank you so very much. It was amazing to have you. Maybe to Ronald, what do you want them to remember in a minute?
I want them to know that actually kidneys play a very crucial role in your body than many people actually think. And also there's a misconception that kidney disease only affects the old people, but actually that's not true, because I've even seen smaller children who have kidney disease because through our initiative that I mentioned, RKF, Kidney Health, we do charity donations before every lecture series, and through those donation drives, we're able to visit a pediatric renal unit that is located at the Kenyatta National Hospital, and we're able just to visit the children to support them with the essential items that they need during their stay in hospital, just to make their journey much more easier, and also have a conversation with their parents just to offer the emotional support that they need. I would love them to know that kidney disease affects people across all ages and also all races, the genders, and ensure that you take care of your kidneys. And taking care of your kidneys if you're healthy means eating well, as doctor has mentioned, and also ensuring that you drink a lot of water and also exercise regularly. Ensure that you also check on your weight and also maintain your weight.
How can people join your initiative? How can they get to meet you?
You can check out our organization through our social media accounts, and also on Instagram. You can check me as Ronald Kasyoka on Instagram, and also Facebook, LinkedIn, across all the channels on as Ronald Kasyoka. And now the organization RKF, Kidney Health. You can also reach out through through the social medias, we'll be able to respond to you through the organization.
Where are your books available?
My books are available on Seller.
Seller.
You can access now through the social media accounts on my Instagram. I have the link there. And also, my contact is still on the bio. You can be able to reach out and get a copy of the book. And for the first book, actually, Bracing Up, it has been actually one of the support resources for the organization. This is actually how we started the organization, RKF, Kidney Health. Immediately after I released the book and we were able to sell a few copies, we decided to use now those the resources that we had gotten to start out the organization. So it's actually been sustaining much of the work that we are doing. And also we are also able to reach out now to friends and also the partners through now the programs that we run, the quarterly lecture series. And also last year in November on 18th, we launched something actually spectacular, the Keynote Advocacy Awards. We realized that as an organization, most of the keynote advocates in the country, they do the work that they do out of the passion and also the conviction that they feel they are doing something good. So we wanted to honor them and also celebrate them for their amazing work. And now the Keynote Advocacy Awards. So this year, it will be now the second edition of the Keynote Advocacy Awards. You can reach out to the organization and just plug in one of our programs. We have so many programs running on.
Thank you so very much, Dr. Bagha. Thank you so very much, Ronald. We are so much glad for the enlightenment, for the story, for the journey. You have made our lives even better. So thank you even for our viewers, even for the questions. Just to remind you that JCK Hospital, who is our key sponsor, they have a key announcement coming up this week. Next week on the 16th, 17th, and 18th, they have a medical camp coming and a wellness clinic at Juja Farm from 9 a.m. to 3 p.m. Juja Farm. For kids 7 years and below, go for checkup, free screening. A lot of services will be offered free of charge. Remember to check out their social media handles. As well for JCK Roysambu, they have a medical camp happening at OFC Thika Road, Blessed House, just next to Garden City, all the way from 9 a.m. to 3 p.m. It's open to the entire community. Come for screening, come for cervical screening, and all other services that would like to be served that particular day. So we appreciate you for the support. We appreciate you for tuning in, and thank you so very much for getting to create time to learn about kidneys this particular morning. Remember that it's your responsibility to go for checkup. It's your responsibility to build your hope while you go through dialysis. It's your responsibility to check the diet you're eating. It's a responsibility to also check your exercises. Some of these things are naturally coming, like exercise, water, and even the diet. So before it heightens to other stages, make sure you're taking care of your kidneys. So it's a very important organ. Maybe that's why God protected it and put it at the back. So see you next on the next section next week, Tuesday, same time, same place. This is the Health You program by Stanley Museti, where you stay informed and to lead healthy lives. And as usual, adios, muchachos.
At JCK Hospital, we understand that a child's smile is priceless. That's why our dental services are tailored with care and compassion to ensure your little ones have the best experience possible. From gentle checkups to specialized treatments, our pediatric dental experts create a safe and friendly environment, making every visit fun and stress-free. Because we believe healthy habits start young. And for the grown-ups, we've got you covered too, with top-notch dental care for the whole family. Visit JCK Hospital today, located in Roysambu, opposite Park University on Lumumba Drive, and experience dental care that's gentle, professional, and family-friendly. JCK Hospital, you first.